Willow Creek Springs presents Healthy Living with your host, Joe Grumbine.
Well, hello and welcome back to the Healthy Living Podcast. I'm your host, Joe Grumbine, and today we have a very special guest. Her name is Stacy Roberts, and Stacy's got over 30 years of experience helping patients live pain-free while achieving their health goals. And I don't know about you, but I don't know too many people that are over maybe 25 that don't have some kind of pain. And you wrote a book called The Pain-Free Formula, a holistic approach to finally getting rid of joint pain without surgery, drugs, or injections. And that just came out recently. So, Stacy, welcome to the show. And we're just so glad to have you. So why don't you just share a little bit about your journey here?
Oh, sure. Thanks so much, Joe, for having me. I really appreciate you introducing me to your listeners. Basically, my journey here has been, over 3 decades and trying to just help people move better, feel better, and then somewhere in between there, helping them with their optimizing their hormone levels and gut health and addressing adrenals and thyroid, all those good things that help us feel good and stay active for as long as possible.
So,
So,
when
yep.
you first realized that this was something that you were called to work with or work on, do you suffer any kind of pain, or is this just something that you were just called to do?
So I've been an athlete all my life, played it collegiately and then also coached as well too. So try to stay active as possible. So I've definitely had pain over the years. But one specific experience that really made me want to write the book was about 3 years ago now. I was
Mhm.
at a family wedding. And I was doing the polka with my son. Well, he was trying to do the polka, and I watched him, and I was like, "Oh, brother, I got to show him how to do this." So I went out there and we were doing the 1, 2, 3, 1, 2, 3, and all of a sudden a huge pop in my knee. It felt like somebody took a knife
Oh
and
no.
stabbed the inside of my knee. And I literally couldn't put any weight on it and kind of dragged myself off the dance floor, and it swelled up immediately. And so I had to leave the wedding early, and I had to get crutches. I sent my son for crutches at like 2 in the morning, poor kid.
Uh,
But then I have a device called SoftWave in my clinic. So I put that on there right away and the swelling went down
oh,
immediately. And I was able to walk without crutches within 3 treatments. But
wow.
I was really curious about what that pop was in my knee. And because as a physical therapist, I know all the structures, I know what it could have been, but I got an MRI and an X-ray and just wanted to discuss with a colleague about, what it could have been. So I went to an orthopedic surgeon, and thought we'd have a great conversation about, what the structure might have been. And she put the X-ray up on a screen, and she basically said to me, "Well, it looks like you need a knee replacement." And I was like, what? So she said your knee is full of arthritis, and that's where your pain's coming from. I'm like, wait a minute. So I didn't have any pain before this. I had surgery on that knee like 35, 40 years ago, but I hadn't had any pain before this. That arthritis that I'm seeing just didn't happen because of the polka. You know,
Right.
you,
Takes a while to make that stuff.
Exactly. So I was really confused as to why that was her first. I said, so, okay, I get that, but what do you think the pop was? And she said, it doesn't matter. This is what we can offer you. And she's like, if you don't think you're going to do a knee replacement, I can offer you a cortisone injection. And I was like, well, I already have degeneration in my knee. Cortisone increases degeneration. Why would I want to do that? So
Right.
suffice to say that at the end of the appointment, I knew I wasn't coming back to her, and she probably was very happy that I probably was not coming back to her as well too. I really was trying to be a patient, but at some point when she, said that, oh, you'd need 100 cortisone injections to cause degeneration, I just was like, wow, that's how many people are getting this information that's inaccurate based on the new research. So that's what really spurred me to write the book. Because I've had pain on and off, and I've helped my patients. I've gotten rid of migraines that I've had from working on my gut health, and pain here and there with some plantar fasciitis and shoulder stuff. But I really want to get this information out to more people, because I realize that just in my area in Milwaukee, Wisconsin, I can make a really good impact. But if other people can take this information to their providers and can help them, then I can have a even a bigger impact.
Now, I have a question that's a little off topic, but I always try to connect the guests' perspectives about, where the problems lie in the healthcare side of things. And, in the old days, doctors were very well rounded and they had broad practices and they were general practitioners and they got to know their patients and they knew more about the patient than just the problem they came to. And nowadays, everybody's so specialized. They get highly trained in the thing they know, but aside from their, whatever, 8 years of medical school, general knowledge of things, they don't practice any of these other things. And surgeons, most noted, my father was a foot surgeon, so I know all about surgeons.
Yeah.
And, they have this sort of, way forward and there's limited options and they go, well, if this, then that, and what do you want to do? Do
Mhm.
you find that to be problematic?
Yeah, I think there's a couple things there. Like, for example, surgeons are going to be amazing at surgery, right? At least we hope if we're going to them for that.
Hopefully.
I just saw a patient just a few days ago who had a bunionectomy and needed to have, or the surgeon fused a joint in her foot. So now after the surgery, her bunionectomy pain is gone, but now she has pain because they fused that joint. So now
Right.
another area of her foot is stressed. So she has pain and they're basically saying, well, nothing we can do about it. We fixed the problem. So now you have to deal with this other problem. So she's coming to me for, soft wave therapy and other things to help with that. But I think, yeah, I think they get to the point where they see the issue on an X-ray or MRI. Oh, I can fix this, and they fix that, but they forget that everything's connected, or maybe they don't forget that. They just don't have time to really focus on that. Everything's connected. Their job was done. Now it's, afterwards we see how the body adjusts, right? So, but at least that original pain is taken away. But sometimes, as when they do surgery and what they think is wrong, the pain is still there because the root cause of the pain wasn't addressed. It was just looked at on an MRI or an X-ray. And that's
Right.
not always, just because you see something on an MRI or X-ray doesn't mean that's always the problem. So yeah, it can be complicated. But I also, when we do have general practitioners, right? But I also think they only have like 10 minutes per
Right.
visit. So how do you really sit down with somebody and in 10 minutes figure out what's going on? So that's where it comes. The prescriptions to just address the symptoms are the easiest thing to do. And unfortunately, if we as the consumers of that system aren't accountable for our own health and ask questions and do our own research, we can fall into some unfortunate traps of, taking medications to cover up symptoms and then other things pop up, either side effects of those medications or the underlying issues and address some more things, pop up down the line. So it can be quite complicated.
Well, I appreciate that at least you and many other practitioners are looking at it from sort of a bigger picture. Because like you said, everything's connected. The old song, the head bone connected to the tailbone
Yeah,
or whatever. But I mean, it's so true.
exactly.
Everything's interconnected,
Mhm.
even on all levels. But when somebody comes to you, they've either been injured and they're healing from an injury, or they are post-operative or post some treatment, and you're helping them retrain, regrow, heal, repair, right? And so you have some understanding at least of what was done,
Mhm.
because you're
Better.
familiar with those things. And you have all these tools, you think about physical therapy and you think about whirlpools and stretching and exercises and stuff and things that hurt a lot. Um, I hear you keep mentioning this soft wave technology. I'm very curious to hear about that.
Sure. So SoftWave is a technology that I came across about 5 years ago. I never use modalities in my practice. Whirlpools were about 30 years ago, so I'm done with that, Joe. But prior to having SoftWave, I would do what's called manual therapy, putting my hands on somebody, help to initiate greater movement patterns, take stress off of an area. We might do some functional exercises, or we usually do functional exercises. But then I came across SoftWave, which is a type of shockwave device. And what I found is there's a bunch of different shockwave devices. A lot of them have very different outcomes. But SoftWave in itself, what happens is it creates a shock wave that penetrates into the body. This one goes very deep, up to 4 to 6 inches. It could get into joints where I can't get with my hands. So patients will be like, oh yeah, that's the pain that I normally feel, when that's like a gold mine to a physical therapist to be able to go, oh, okay, that's the familiar pain that I feel. Now I know what structure's involved. Now I know what I can treat. Now I know what the best exercises are for. So it really gives me some great information, but also it also helps to decrease, or what they call modulate, inflammation. So it helps move a person from a very inflamed state into an anti-inflammatory state so the body can heal. So Joe, if I scratch my hand a million times here and it was red and puffy, that's the pro-inflammatory state. In order for my body to heal, it's got to move from that to an anti-inflammatory state. And if it gets stuck in that state because I keep scratching it, or if you keep walking a certain way that keeps irritating your knee or your foot or whatever, that's a trigger that if we don't get rid of that, the inflammation is just going to keep coming back. So SoftWave helps to really get rid of, or at least modulate, move that inflammation from one stage to another to allow the body to heal. And then my job as a physical therapist is to get rid of the trigger that keeps triggering it. So find out what that scratch is so I can get rid of it and make sure that there's long-term healing in the body as well.
That seems so different to the symptomatic approach that I'm just so sick of.
Yeah.
I mean, and I say that because as you get older, everybody is being treated for something,
Right.
it seems, and you just keep hearing these same stories again. Well, it gave me this, and then I got to take that, and then I got to take that. Before you know it, you're on this whole cocktail of drugs, and none of them are actually healing you.
Right.
And so you're going at it from this other point of view where you're not giving people drugs. You're actually, creating a place. And the thing that's funny, I think, is like the human body does the work, right? It repairs itself. You're not fixing them. You're sort of aligning things so the body can just do what it does, right?
Exactly. We want to give the body what it needs, right? So it needs nutrition. It needs to have, your gut health is a huge part of that. If it has those basic things, then when we give it what it needs, it'll heal. I had, patient that that came to me for hormone issues. She was trying to get pregnant. We worked, I sent her back to the doctor because I had a feeling she had celiac disease, and she did. And we started working on her gut health over a period of time. And the doctor did what's called an endoscopy, where they go down and look at the small intestine to see the damage. And he rated the damage in her gut as an 8 out of 10. So after a year of working with me and doing things to optimize her gut health and optimize her hormones, she said, hey, I feel really good, but I want to go ahead and have another test to see if the damage was taken care of. And I said, the research says that it's probably not going to improve the damage, but yeah, I mean, that would be great to see it. So she convinced her doc to have another one done. She had to pay out of pocket because insurance wouldn't cover it. That same doctor did the test and said, if I didn't do the first one, I would have said you were misdiagnosed because I don't see any sign of damage. And she had gotten rid of but we nurtured her gut health and we gave her what her gut needed in order to heal. And, a year later, her gut was in great shape. So if we give the body what it needs, based on, our own makeup, it absolutely has amazing healing powers.
So you're going through your practice year after year, working with these people over and over, and you're now starting to see, wow, we're actually having a real impact on people's lives. It's not just, oh, I feel better now, but next month you're going to have to go and do that thing again. At what point did you go, wow, I'm onto something? Like I have something I want to share with the world.
I think it's been a 30-year journey of feeling that way because, when I started out as a physical therapist in the 90s, people would generally get better, but then there are those few that it just bugged me because they weren't getting better. And I was like, why is that? So then I studied a little bit more about the emotional impact, and the brain's impact on pain. So I started adding some of those things into my practice. And then some of those people, weren't getting better. I'm like, oh, why is that? So then I studied hormones and things like that. So it really was this journey of me being able to find kind of these sweet spots, this combination that I feel like, in the last 5 to 10 years, really have been able to put this together for patients. Now, 70 to 80% of the people that come to see me, if it's a localized issue, they get their advanced physical therapy, which includes, the exercise, very specific exercises, but manual therapy and soft wave, and they do extremely well. And some of them do need some maintenance where they come back once a month if they, want, to, continue playing a sport or something, and they just want to prevent an injury, not necessarily treat something afterwards. But then the rest of the people, by the second or third treatment that they're seeing me, if they're not 50 to 100% better by that time, I'm going, what's going on, right? So is it their hormones? Are they in perimenopause? Is it a male who should have improved and he hasn't? Is it his testosterone? Is it their gut health? What does that look like? So looking at all those things together has really helped me get those 25 to 30% of people even better, where I wasn't able to before. And it's very easy, Joe, for PTs or any healthcare professional to be like, oh, the patient's just not doing what I'm telling them to do.
Right.
Oh, they're just
You
not
don't know what they're doing when they're not with you.
right. Oh, they're just non-compliant. Da, da, da. So that's a great excuse that we use. But many patients, not all, many patients are doing exactly what we want them to do. And they really want to get better. So for those patients, when we look at those other aspects of their health, that really creates a nice little program for them to, manage their pain and get rid of it in many cases, and then stay as active as they can be for as long as possible.
So when a patient is in your care, I mean, you have multiple goals. One of them is obviously to get them on a path to healing, but it sounds, based on what I'm hearing from you, you're concerned about their well-being after this. And so you're likely giving them sort of some advice on how to proceed forward after they leave your care. But there's a little bit of a dichotomy with the human body. So sedentary behavior is very problematic for human beings. So we're always told we got to move, you got to move, you got to move. But then when you take that up past a certain point, you have the farmer who's working all the time, or you have the rancher, the athlete, who trains and trains and trains, and then they burn their body out too fast, and it has this sort of negative impact over a certain point. So it's not like we get the idea that if something good, more of it is better. And
Right.
so people are zealots and are like, oh, I found this thing, so now I'm going to do so much of it. And then they take it till it breaks.
All right.
Sounds like balance is very important to you. So how do you reckon with that?
So it's a great question. We tend to do that, and when we do that, we're looking at one aspect of the body, right? And how, we love moving. Like you said, we need to move, because if we don't move, then things can atrophy, slow down. But it's the patient that's trying to move, but they have pain and they don't. So then they stop moving as much because of the pain, and then they're on these medications and to decrease the pain, which research shows that those actually contribute to more pain in the long run. So it can be very complicated. It's a lot of education around, okay, how do you move so that you're not irritating that, right? What can you do to stabilize, right? And then recognize your personality. Are you now feeling really good? Like with soft wave, in the first visit, the patient will feel 50 to 100% better. That may not last forever, usually lasts for a couple hours, up to 2 or 3 days. But if they all of a sudden feel great and then they go out and play 3 hours of pickleball, they're going to end up being back where they were. So a lot is education about, okay, your body's still healing, right? And like we said before, if that person's, like you said, just going for it and just doing as much as possible of what they like, we have to also educate about balance, right? Balance and how our body changes as we get older, what it needs besides more like cross training to help staying fit as far as exercise, but not forgetting that the joints and the muscles in our body need nutrition. I work with some elderly people that are like, I don't understand why I don't have the leg strength that I used to have. And I say, what did you eat today? Well, I might have had a boiled egg and, a piece of toast and then a glass of wine for dinner. Well, the body's not getting the nutrition that it needs to feed the muscles, right? So we need to look at nutrition. We need to look at gut health. We need to look at stress management, optimizing hormones, all those things for us to, again, take a holistic approach. And, so I have to recognize if I've got that patient in front of me that is just putting their foot on the gas pedal all the time, and just have to help them work around that in the best way possible.
So you touch on nutrition, and obviously that's one of the pillars of health. I mean, you have, stress and sleep and nutrition and all these things that are just absolutely necessary. Oxygen. I mean, these things that if you don't have, you don't live. And nutrition's clearly one of the pillars. But now today, in with all the information out there and every expert, there's too much information, and there's people that are saying you have to be vegan, there's people that say you have to be a carnivore, and there's people that say, do this but not that, and everybody's right and everybody's an expert. And I don't think it's that simple. I think different body types and different genetic dispositions, and like you were even talking about hormones, different stages in life, I don't know that there's a one answer. And
Yeah. I,
as
yeah.
you are in one role to be a nutritionist, you almost have to really spend some time with these folks. How do you reckon with that?
Yeah, so it's really is complicated because again, the way that we're kind of conditioned to think about health. Like I get really irritated when I see some gurus out there who I know are very smart, just saying, okay, all this is not good for you. This type of food, don't eat that type of food. Well, that may not be good for you, Joe, but it might be perfect for me, right?
Exactly.
So the personalized medicine is really important moving forward, personalized health and wellness too. So what we do is we encourage micronutrient testing. So what nutrients does your body specifically need? And then we can create that supplementation program around that based on what your body's missing. And then we tend to look at just an anti-inflammatory eating plan. But even like a Mediterranean diet where you've got good fats and good carbs and good protein, even that sometimes good healthy food, you could react to something differently than I react to it. So then we do food sensitivity testing, because I know for me, if I eat gluten or if I eat certain types of foods, I get pain in my back and it shoots down into my foot. I couldn't resist this chocolate chip cookie this past weekend, and I knew it had gluten in it. I'm
That
not
hurt.
celiac, but I had it, and I felt the next morning like I had a hangover. Like, my knee was aching, my toes started to cramp up, and I always hope that that's not going to happen, but it always happens. So that's for me. But I don't believe that everybody has to get rid of gluten because it isn't the same for every person. So that food sensitivity test that we recommend helps me say, okay, Joe, these are the things that we need to have you stay away from for a period of time. And then we're going to work on your gut so that hopefully you can add those things back in and then, improve. So that's the same then with, so we've got our, supplementation, but always want to work on optimizing our eating plan. And we do know what foods are anti-inflammatory. That's not a secret, right? And just minimizing the foods that are pro-inflammatory and get rid of the ones that we're reacting to will help to manage our inflammation. And then as we, get into those hormonal transition, also supporting hormones either naturally, and some people can get hormone replacement therapy. But my thing with that is it must be monitored and must be looked at consistently over time in order to make sure you're not getting too much or too little. So it's we take a very personalized approach, which I think is what most people want, right?
Right. Oh,
Um,
yeah.
is just everybody remove all of this type of food. I just don't think that it is really the way to go because everybody's so different.
Agreed. Well, let's get to the book. You've just published this last month.
Yeah, so it's out right now, or it should be on Amazon. Definitely after April 1st. I've got the proof coming to me today, so I'm excited
Nice. Oh,
to
wow.
review that. And then, so the book is in two parts. One is the way conventional medicine right now handles pain. And so if you're dealing with something, taking medications for pain, or you're considering a surgery for pain, or all the different types of ways that medicine right now addresses pain, I just give you more information to really educate yourself on, what potentially you can do to work around those things, especially if you still have pain and you're doing this stuff, something's not working. And then part two is going into, okay, how does your body move? How can we correct those things? Then we talk about soft wave therapy, why that's really important. Then we talk about hormones. Then we talk about gut health. And then we talk about stress and adrenals and thyroid. And we talk about how the brain actually changes with chronic pain. And each of those chapters give you information about what you can do to optimize your overall health. And then once you have that book, I also have ebooks that dive even deeper. Let's say you're in perimenopause, or you, Joe, are in andropause, and you want more information on hormones. So I've got an ebook that digs even deeper into that.
Nice.
And then after April 5th, I'll have a quiz out there that you can take to say, okay, what probably is my issue? If I've been having pain this whole time and I can't get rid of it, is it biomechanics? Is it hormones? Is it gut health? Is it stress? And I have you go through a series of questions, and it gives you some specific likely areas to focus on, so that you can really kind of personalize your own situation with guidance from, your physical therapist or physician or massage therapist or acupuncturist or chiropractor, whoever you go to as your trusted professional.
I love it. I really believe, I do a lot of this talking to a lot of different healthcare professionals, and I think the purpose of this all is to give the patient instruction, because ultimately the patient has to find their way to health. And it's not just that you find one guru and do what they say. You have to explore until you find those answers. And if you find some good guidance, it's still important to keep going. It's an ongoing situation, and I think that you're giving very good advice with regards to that. Have you considered, or are you considering doing an audio version of that?
Yes. So the next step now, once everything's up on Amazon, is doing Audible version,
Nice.
and recording that, because that's actually the way that I consume my books these
Me
days.
too.
So that will probably be out, I'm hoping, in the fall,
Nice.
because it's a 380-page book, so it's going to take a little time to record.
Exactly. Well, I think this is fantastic. Now, your practice is in Wisconsin. Now that you're launching this book, I suspect you're going to be approached by a lot of practitioners um, looking for guidance and more information. Do you have a plan for that?
Yeah, great question. Thanks for bringing that up. I don't know if you've heard of MedBridge before. It's something that's common in the physical therapy field. So MedBridge is a kind of a seminar company that gives information and creates like exercise. Therapists can use it to create exercise programs for patients. I'm creating a couple courses on MedBridge, and then eventually, and this will probably be into next year, have an online course for practitioners to learn a little bit more about functional medicine related to help patients manage and eliminate pain. So that's definitely in the works, because I want to, because I can't see everybody as much as I would love to. I do have to sleep, Joe. I do have to sleep. Sleep's important.
Exactly. One of the
So,
pillars.
right, exactly. So I want to have something like that available to other practitioners to be able to follow through with and help more patients with as well.
I love it. I like the approach you're taking. I like that you're taking this knowledge and you're making it so that other people can take it, learn it, and pass it on. This is sort of your parting shot. I give you a chance to share any information as far as how people can reach you, or any other last thing you'd like to share.
Thank you. So they can go to NewYou, that's NEWYOU, healthandwellness.com, and check out our website. They can email info at newyouhealthandwellness.com. We've got a health tips blog on there as well. And so they can go through, different articles if they like. We have our pain-free podcast. So if they go to newyouhealthandwellness.com and look for the pain-free podcast, every week we're putting up different episodes.
Nice.
How you can address pain. And also I'm having interviews with experts coming on to say, okay, experts, not just in the field, but also patients that have said, hey, this really helped me, and to see how those patients can help other people, because that's what we're really here on earth to do, right? Is to help each other.
Exactly.
Mhm.
Fantastic. Well, Stacy, this has been an incredible conversation. I'm glad to have met you, and I would welcome you to come back if you want to further discuss some of these things. And for everybody, I thank you for supporting this show. And this has been another episode of the Healthy Living Podcast. We will see you next time.
This has been another episode of the Healthy Living Podcast. We produce this show so that people can share their stories, people that have overcome obstacles, people that are undergoing obstacles. We're building a community of health-minded individuals. If you're interested in supporting the show, please leave a review on the platform you're listening to it on. If you're interested in becoming a guest, please send an email to itsjoegrumbine@gmail.com, or you can send a note into the notes section of the podcast. All right. Well, thank you for supporting this show, and we hope you've enjoyed it.